Welcome. My name is Dawn Macary, and I'm with the Western Connecticut Area Agency on Aging, and we have a new show entitled Working Together with the Western Connecticut Area Agency on Aging. Our agency serves 41 towns of Western Connecticut, and we offer free, unbiased information to individuals on Medicare, persons with disabilities on Medicare, regarding Medicare insurance, Medicare Part D, Medicaid, if you're new to Medicare, respite care, the home care program, money follows the persons. We have assistance in filling out applications. We do the Senior Medicare Patrol, which is Medicare fraud, and a variety of other programs to help keep individuals independent and at home. And today I am really happy to have with us is Cindy Kozak, and she is the Diabetes Prevention and Control Coordinator, long title.
That's correct.
For the Connecticut Department of Public Health. And she is going to be talking about a very important subject to many of you out there, and it is living well with diabetes. So before we get started, Cindy, could you tell us, the audience, a little bit about yourself?
Sure. Yeah, I've been working in diabetes now for about 20 years. Wow. I'm a registered dietitian and certified diabetes educator. So what that means is I did a lot of work previously in nutrition, but then specialized later in my career to become a certified diabetes educator, which is an important part of the healthcare team for anyone with diabetes. So anyone that has diabetes really should ask their healthcare provider about seeing a certified diabetes educator. And we'll also, of course, talk about our Live Well with Diabetes program here today as well.
Oh, very, very good. So what is, because this has always bothered me too, what is type 2 diabetes?
So it's a great question, and type 2 diabetes is important to know. It constitutes about 90 to 95% of the cases of diabetes are type 2. Type 1 diabetes we used to call juvenile onset diabetes, but we call it now type 1. And type 2 diabetes we used to call adult onset diabetes, but we call it type 2 now. Part of the reason for that is, unfortunately, kids are getting type 2 diabetes. It's getting younger and younger at the age of diagnosis, but it's characterized by insulin resistance.
Okay.
So in type 1 diabetes, the body isn't able to produce insulin and the person must take insulin. Whereas in type 2 diabetes, there could be a lot of insulin around, but it's not getting used properly. So some people with type 2 diabetes do need to take insulin. Others might take medications, whether they be oral or an injectable form of medicine, or some people may be able to take control with diet and exercise. But it is a progressive disease, and people should appreciate that they can take good charge of their diabetes type 2, sometimes with diet and exercise, but often it will progress, and it's not the fault of the person, but as they get older and the pancreas gets more tired and isn't able to produce enough insulin, then people may need some medicine to help. And really working with their healthcare provider is so important, because we want to prevent the complications of type 2 diabetes. Yeah, sometimes people say, I have a little bit of sugar. Well, that little bit of sugar can be very dangerous. And so my job is to convince people to take type 2 diabetes very seriously. The slogan we use is, you control it, so it doesn't control you.
Okay.
Because as time goes on, if the diabetes is not controlled, the complications are horrible. Eye disease, kidney disease, lower extremity amputation, but heart disease and stroke we can't forget, because that's the #1 complication
with
of diabetes. Yes.
I wouldn't have thought that.
Yeah, a lot of people don't appreciate that there's such an important association between those high blood sugars and the risk for heart attack and stroke. So it's so important that people take this seriously, they take control of it, that they self-manage the disease, of course, working with their healthcare provider.
Right.
But the program we'll talk about today, Live Well, and other forms of diabetes management really emphasize the self-management part of it. And if you think about it, people go to a doc 15 minutes
Right.
4 times a year.
Yep, that's about it.
And then in between, they're doing all the self-management. So daily, people are making hundreds, if not thousands, of decisions about what should I eat and what's my blood sugar now? What's this going to do to when I exercise? How do I adjust my insulin dosage if that's what my healthcare provider and I have worked out? So it's so important that people appreciate how much control they have.
So they are checking their insulin daily with type 2?
Well, they're checking their blood sugars daily.
Blood sugar daily.
And some people with type 2 are taking insulin, but we recommend that everyone with diabetes check their blood sugar, depending on what their insurance will cover.
Right.
Some plans will allow for more strips, but I've seen people with type 2 checking 6 times a day, 8 times a day, really wanting to know where that blood sugar is, depending on how well controlled they are.
Really, it's quite a serious disease.
It's very serious, and that's, I think, the take-home message for people. It's not just a little bit of sugar. It's a serious disease with complications that can be prevented. So we really want to urge the audience to take this very seriously.
Well, I think that's why you have the state has the Live Well with Diabetes workshop.
Exactly.
Okay, which sounds really interesting for people. What is that all about,
So
Cindy?
the Live Well with Diabetes workshop is an evidence-based program that was developed at Stanford University in California. So they did a research on what works with the program and how to tweak it to make it better.
Yep.
And the program is all across the country and, in fact, all around the world.
So this is national.
This is national, international, in fact.
Oh my
It's
God,
been
that's
translated.
fabulous. All
Yes,
right.
it's wonderful.
Great.
Been translated into several languages. In Connecticut, we offer the program in both English as well as in Spanish.
Okay.
And that's an important point because Hispanics are a high-risk group. We know that people of Hispanic origin, as well as African American, Asian Americans, and Native Americans are high-risk groups. So in Connecticut, we really are targeting some of those populations that need to come. African American, of course, is a bit easier for us in English, but we do have several Spanish-speaking leaders that can conduct these programs. And the whole gist of our program is that it's led by 2 leaders, always 2 leaders, one of which may be a lay leader.
All right.
And it's a leader that's gone through our training program to learn a scripted program. So it's really in concert with the healthcare provider because our instructors are taught not to answer questions. They don't know the answers to the questions.
They're not doctors.
They're not doctors. They're referring people back to their doctor.
Okay, sure.
So the program lasts for 6 weeks.
6
it's
weeks.
2.5 hours each week.
Okay.
It goes by very quickly. We take a break in there because people need to stretch and talk with their classmates. So we have a variety of topics. We start each workshop with action planning.
Okay.
Action plans are so important because it takes all of this myriad information that people have heard and makes it into some doable steps. Our action plans are key and very interactive. And the action plan is really geared to something that the person wants to do, not what their doctor has told them to do or their daughter, but something that they want to do. And it might be, gee, I'm going to increase my vegetable consumption this week. So on 4 days, I want to eat 3 servings of vegetables.
Right, okay.
So it's very focused goal.
Now, are they telling you what they would like to do?
Exactly. Yep.
So
We're helping them to set that goal, but we ask them, what are you going to do? When are you going to do it? How much are you going to do? And how confident are you that you can do this? So we really kind of hone in on the specifics. And then the following week, people come back and they tell us how they did.
Okay.
They met my goal, great self-management, or if they didn't meet the goal or they partially met the goal, we'll say, okay, let's do some problem solving. See what got in the way so we can help you to achieve it better the next time.
Well, it probably makes it nice because you're around peers, the same people that have the same disease.
That's exactly
so they
right.
can compare notes, which is nice.
Exactly
You
right.
know, so, and this goes on for 6 weeks.
6 weeks, yes. Other topics that we cover in our diabetes class, some are very diabetes specific, very important. Foot care, because we talked about lower extremity amputations. And I know I've heard that 80 to 85% of those are preventable just by people checking their feet.
Really?
Yeah, and it's amazing seeing a red spot that maybe the person doesn't feel or a blister that they don't feel, but it gets infected. they wait too long to go to the doc, and the podiatrist ends up doing some radical surgeries.
Oh my goodness.
So we talk about foot care. We talk about sick days. People with diabetes have an important job of controlling their blood sugar on a day-to-day basis. And when they get sick, that blood sugar goes even more crazy, and they're not exercising the same, they're not eating the same.
Right.
So we spend some time talking about sick days. We spend a lot of time talking about nutrition because of the effect,
it's important,
of course, of healthy eating and the effect it has on blood sugars. We talk, of course, about exercise. We talk a lot about balancing. And of course, we need to talk about what, in the first place, what should my blood sugar be? Again, individualized with the healthcare provider, but we use the American Diabetes Association guidelines for what blood sugars ranges should be, and then specify that if your healthcare provider has told you differently, to respect that.
So this sounds like if you have diabetes type 2, this is something that could be fun to go to, and you're learning about your disease, how to fight off the fatigue and different things like that come with diabetes. So it really is but it is 6.5 weeks. What happens if someone were to miss a week?
So it's 6 weeks.
6 weeks, I'm sorry.
For 2.5 hours each week. But you said a key word. It is fun. It's very interactive. It's different than other diabetes education that I've done, which tends to be, they're very good. And I think the diabetes education options that are open to people in the hospitals are another good option. And we like to work with the hospital programs to cross-refer, so that maybe someone goes to a program at Hartford Hospital and then comes to our program as a follow-up. So it's a great way to get both aspects. Ours is very interactive. You said the word fun. People really do enjoy it. It is, as you said, 6 weeks. We ask that people look at their schedule, and if they can attend at least 4 out of the 6, we're good. If they're going on vacation for 3 weeks to Florida, then it's not good. They're going to miss too much and wait for another class to come up.
Is there an age limit on this, Cindy?
No, there really isn't. We will take anyone above the age of 21. It's for adults.
So this is a good thing to remember. And if you want more information on the Live Well program, Live Well with Diabetes, I am talking to Cindy Kozak, and the number is up on the screen that you can call. That's our agency number, and you can ask for the Live Well program, and we can connect you up with a screening, a seminar that might be going on.
That'd be great, yes. We offer the program in a variety of venues. I know a lot of senior housing places have done it. We've done them in the Waterbury Senior Center. We've done them in libraries and in churches. So if people have a group, maybe at their faith institution, gee, a lot of people in my church have diabetes, call that number. And we may be able to get a group right geared to your organization.
How many do you like in a group?
Good question. We need to have at least 8 people.
At least 8. So if you're out there and you're listening, and this is something you think you might be interested in because you have type 2 diabetes, and some of your friends do, and you live, as Cindy said, in a housing site or at your church, this would be a great opportunity to get this program there at your facility and to learn how to control your diabetes a little bit better.
Very good. And as I mentioned earlier, we do have some Spanish leaders. And we know that it's an important population to reach. So if you have a Spanish group, we may be able to accommodate that as well. We're always looking for leaders, too.
Oh, okay. You're always looking for volunteers?
Yeah, volunteer leaders. We provide a small stipend in the form of a gas card for our leaders, but it is a volunteer opportunity, and it's a great way to reinforce diabetes information for yourself. If someone has diabetes and they want to really integrate this into their life and become just more proficient with diabetes, the training for leaders is 4 days. And so people learn the program out of Stanford University. We give them everything they need. It's basically a script that they follow, but it's a lot of teaching in there.
Oh, I would think so.
Yeah, if someone's a retired teacher or a retired healthcare professional, that's great. Or a person with diabetes that just wants to help other people, we know that that's been great. The book that we use is this one here. This is called Living a Healthy Life with Chronic Conditions.
Hold that up so they can see that there. Okay. Oh, that's a nice book.
Yes, so we provide
I like the colors.
Yeah, we find that people really enjoy the book. We provide this on a lending library basis. As we mentioned, the class is 6 weeks, so we'll give the book on week 1, but we do ask for it back on week 6.
Okay.
We are funded by a grant from the Centers for
How
Disease.
did you know I was going to ask that next?
So yes, we are funded by a grant from the Centers for Disease Control and Prevention.
Yep.
And because the grant is just a finite amount of money, we can't provide the book to everyone. That would use up our funds more quickly.
I know. Because I'm just going to ask you, is there a cost for this program?
So at this point, no, we are not charging. It
Okay.
is covered by the grant. Now the grant will end, and so in 2018, after that, I don't know what we're gonna do after that. We are able in some places to bill Medicare. In one of the organizations that we work with, they have achieved recognition for this program by the American Association of Diabetes Educators.
Okay.
And with that recognition or accreditation, they then went on to pursue the paperwork for Medicare reimbursement. So that will help our program in the long run to be sustainable after the grant ends.
Oh, that's great. That is great. So, and where are they held? And do you hold them at nighttime? Because you said it was for 20 and over, I think you
Yes.
said. So, I mean, some of these people are working. Do you hold any night
There
workshops?
have been some evening programs, yes. We have done some weekend programs as well. So depending on the availability of when the leaders can do the program, it could be in the evening. And as we mentioned earlier, it could be in a variety of venues. The senior housing, we've done them at work sites.
Could have them at our agency on aging.
You could have, if you had 8 people at your agency on aging with diabetes.
Right.
Yes.
Right. But this is a great program for people with diabetes type 2. Again, I'm talking with Cindy Kozak with the Diabetes Prevention and Control Program, and she does the Live Well program with diabetes. And as she said, if you can get 8 or more people,
Right.
they can set up a program for you, and just call the number that's on the screen, and we'll connect you. But how do they sign up for these programs?
So
if we have just an individual out there that says, wow, this really sounds good for me, I would love to learn more on how to control my disease,
Yeah.
how would they sign up?
So they would call that same number, and your staff at your agency would help them to find a program. They may be put on a waiting list because we may not have one exactly at the time and place. But we have a variety of places around the state that offer it. But most likely we would have to regroup that person into a class that's planned.
So if someone is out there listening, if they can actually get 8 people that have diabetes,
Oh, that would be wonderful.
That would be wonderful.
That saves our job. That recruitment is part of the program.
Yeah, because
yes.
a lot of these housing complexes, like you said, there are so many people with type 2 diabetes. I can't believe it. It's astounding.
Well, we know that diabetes rates go up as people get older, and as many as 20% of people over the age of 60 have diabetes.
My goodness. holy
So
cow.
1 in 5, and it's important to take very seriously, as we've already stressed. I can't say enough how important it is to really take this bull by the horns.
Now, how was this program developed?
So it was developed at Stanford University in California. They actually started with a Spanish group.
Oh, okay.
And they had the input of certified diabetes educators and people with diabetes, and they put together the 6 weeks, and then they tested it. They looked at some blood tests, and they looked at a lot of things like communication with their healthcare provider, which is another topic that we cover.
Right.
And they looked at people's self-confidence, that they could make some changes. So they had a variety of measures that they looked at before and after, and they showed that people really did improve. This concept of self-efficacy or self-confidence, or the buzzword maybe now is empowerment.
Right.
That's the biggest thing that we want to get across in our program, because the doc can't do it for you. It's not like fixing a broken arm where you go to the doc and he puts it in a cast and you come back 6 weeks later and hopefully you're good to go. No, it's much different with diabetes and other chronic diseases, where the person really needs to perhaps change the way they cook, maybe look at the way they're exercising or getting physical activity. We look at barriers to why aren't people taking medications, how they're communicating or not communicating with their healthcare provider and with their family, when they need to ask for help. Lots of important aspects that really do affect the disease. We do a decision-making activity. We do a lot of problem solving, and again, that action planning, which is key.
So it's really nice because you have a group of, let's say, 8 people that get together with diabetes type 2.
Correct.
And you can discuss it. And like you said, when you see your doctor, you only see him for 10 or 15 minutes. He doesn't know what you're doing after. And here, this is a support group to help you get through all the difficult times that you have and to share your experiences with others in the group.
Yes, exactly.
I don't have diabetes, but this sounds great.
Well, I hope don't get diabetes just to take the class, but if you did, you would be more than welcome.
What is the best workshop for pre-diabetes?
We do now, as of just a couple months ago, our Stanford Live Well with Diabetes is now also accepting people with pre-diabetes.
Really?
Pre-diabetes is a condition where the blood sugars are elevated, but they're not quite at the diagnosis of diabetes.
Okay.
But it's a real kind of red flag. And the good news with pre-diabetes is that it can be a time where people can intervene to prevent or delay the onset of type 2 diabetes, because the later you get type 2 diabetes, the better. You rather have diabetes type 2 when you're 80 than not 60.
Okay, right.
So pre-diabetes can be a good time to intervene. And although we do accept people with pre-diabetes in this program, I will say a better place to go for pre-diabetes is a specific diabetes prevention program.
Okay.
There are several around the state. Most of them are at YMCAs.
Oh, okay.
And the goal of a diabetes prevention program is to help people lose just a small amount of weight, just about 5 to 7% of their body weight.
Is weight a big problem?
Weight's a big problem for people with pre-diabetes. Most people with pre-diabetes are overweight. And by losing just a few pounds, that 5%, so if you're 200 pounds, that's 10 pounds.
Right.
So losing just 5% of your weight has been shown to decrease the risk of type 2 diabetes by 58%.
Now, how do you know if you have diabetes? I go to my doctor, he checks for the cholesterol. Do I have to tell him I'd like to be tested for diabetes?
It should be in that panel. A glucose should be in the panel. Usually it's a fasting blood sugar.
Okay.
So that's diabetes can be diagnosed with either a fasting blood sugar, an A1C test, which is a 3-month average of blood sugar, or also with a 2-hour glucose tolerance test.
Okay, because I've been at some health fairs too, Cindy, where they test for diabetes and they give you a little prick.
Yes.
Now, what is that?
That's a screening.
Is that accurate?
Sure. Those are depending on the technique. It's typically very easy to do. So assuming the technique is good, it's a screening though, it's not a diagnosis. So if a person were to go to one of these community screenings and get a number that was elevated, they should bring that back to their physician, their healthcare provider, to confirm a diagnosis. That again, it's a screening in the community, not a diagnosis.
So I have a question because I love sweets. I love to eat a lot of candy and cookies. Now I don't have diabetes, but would I be at risk for it?
No, not necessarily. It's not the consumption of the cookies and candies that causes diabetes. However, if people eat a lot of those and they gain 20 pounds and they have a family history of diabetes, and so the slogan that I like sometimes is, we mentioned family history. And so what I've heard is that the genetics loads the gun, but environment pulls the trigger. So if you have a family history and you put on 20 pounds, and you're in a high stress job perhaps for some people, that's a risk factor. So there's a lot of things that go into what makes someone present with diabetes, but certainly family history, overweight, sedentary lifestyle are 3 of the biggest risk factors, well as those high risk groups that we talked about, African Americans, Hispanics, Asian, Native Americans.
Okay. So what about the person that's a type 2 diabetic that wants a couple of pieces of chocolate? Is that going to throw them way off?
Well, the good thing about that's a question that everyone asks. Food is so important to people, and what we talk a lot about in our Live Well program is how you can work in some of those special foods. So you can accommodate that by what we teach called carbohydrate counting.
Okay.
And certainly in the case of chocolate, it's more fat than anything. The other concern we said earlier is that risk of heart disease with diabetes.
Absolutely.
So we want to teach people about the carbohydrate content of their diet because of the effect on blood sugar, but we also need to encourage and promote a low-fat diet so that the heart disease risk is minimized.
Well, this has been very interesting. Again, I thank Cindy Kozak for coming. She's with the Diabetes Prevention and Control Program, and she's the coordinator at the Connecticut Department of Public Health. And if you are listening, again, I reiterate, if you can get 8 people from your church or your housing complex or your senior center, get them together if they have diabetes, and give the number on the screen a call, and we can set up a Live Well with Diabetes workshop for you.
Great. The other thing I would add to that is we welcome significant others. So if you've got 4 people with diabetes and 4 significant others,
that's fine.
We've got 8.
That's great.
Person is welcome.
Well, thank you, Cindy, for being on our show.
My pleasure.
And I'd like to thank you for watching our show, Working Together with the Western Connecticut Agency on Aging. Together, we can help you with many programs available to keep you and your loved ones independent at home. Thank you.